Welcome to the Deep Dive. Today, we're diving into some pretty cutting-edge treatments for multiple myeloma.
That's right. We're talking blood cancer.
Yeah, and we've got this stack of research papers fresh from ASH. It's like a
Super Bowl for blood cancer experts.
yeah, exactly.
Yeah.
And we're focusing on relapsed or refractory multiple myeloma.
Right. So that's when the cancer has come back or maybe isn't responding like it should to the standard treatments.
Like the tough cases.
Yeah, exactly.
And one of the things that really stood out to me flipping through all these papers was CAR T-cell therapy, it seems like.
It's a game changer.
Yeah.
It's revolutionizing how we treat this.
So for folks who aren't familiar with it, can you give us like the quick rundown?
Yeah, so basically it's immunotherapy where we actually reprogram a patient's own T cells to make them super powered cancer fighters.
Okay, so we're talking like engineering the immune system.
Yeah, exactly.
Wow, that's incredible.
Yeah, and one of the papers that we have here looks at the challenges of treating RMM when it spreads outside the bone marrow.
Right, and doctors call that extramedullary disease, or EMD.
Yeah, exactly. It's really tricky to treat because it's not just in the bone marrow anymore.
So it's harder to target.
Right, and this study actually focused on a new type of CAR T-cell therapy that targets two proteins instead of just one.
Oh, so double trouble for the cancer.
Exactly. It targets BCMA and GPRC5D.
Okay, and I'm guessing that's good news.
Well, in this small trial, they saw a 100% overall response rate.
Wait, 100%?
In 6 patients.
Wow. So everyone in the study responded to this treatment.
Yeah, it was pretty remarkable,
Yeah.
but it's important to remember this is just a first step. You know, we need larger studies to confirm the findings
Sure makes sense.
and to see how long these responses actually last.
Right. So promising early results, but lots more research needed.
Definitely.
Okay, so moving on, we have this other study that kind of blew my mind a little bit.
Yeah.
It looks at the immune system's role in how well CAR T-cell therapy works.
Yeah, this one's fascinating. It's all about immune profiling.
So is it kind of like everyone's immune system is different?
Yeah, exactly like a fingerprint.
Okay, so this study, they looked at 120 patients who received this BCMA-targeted CAR T-cell therapy.
Right. And they did this in-depth profiling before and after the treatment.
Oh, so it's like a before and after snapshot of their immune system.
Yeah, and what they found was that the makeup of the immune system at baseline and 1 month after the infusion actually predicted how well they responded.
So that means some people might be more naturally suited for this CAR T-cell therapy.
That's what it suggests, yeah.
So that's huge. Like if you could know that in advance.
Absolutely. It could totally change how we select patients for this therapy.
This is getting really personalized.
It is.
Okay, so let's switch gears a bit. We've also got these 2 studies that compare cilta-cel and ID-cell.
Right. Those are 2 FDA-approved CAR T-cell therapies.
Yeah, so these are like head-to-head in the real world.
Exactly. And it's so important to have these kinds of studies.
So in this first one, they followed a bunch of patients treated with each therapy.
162 with Id-cel gel and 42 with cilta-cel.
And the winner is?
Well, cilta-cel showed a higher overall response rate and longer progression-free survival.
So that means it worked better.
It seems that way. Yeah, but there was a catch.
I was about to say, there's always a catch, right?
Right. Cilta-cel was also linked to a higher risk of neurotoxicity, and specifically delayed neurotoxicity.
Okay, so break that down for me. What does that mean for patients?
So neurotoxicity is damage to the nervous system. It can cause a whole range of symptoms like confusion, trouble speaking, even seizures.
That sounds pretty serious.
It can be, yeah. And with cilta-cel, it can happen weeks or even months after the treatment.
Oh, wow. So that's a big consideration.
It is, for sure.
And what about the second study? Did it show the same thing?
Yeah, pretty much. It was a larger study in the U.S., and it confirmed those findings. Basically, cilta-cel was more effective, but came with a higher risk of this delayed neurotoxicity.
Do they say how much higher?
Yeah, it was about 10% with cilta-cel compared to only 1% with ID-cel.
Wow. Okay, so that's a pretty significant difference.
Yeah, it's definitely something doctors and patients need to weigh carefully.
Okay, so we've got effectiveness and we've got side effects. What else is there?
Well, there's a whole new target for CAR T-cell therapy that we haven't even talked about yet.
Oh, yeah. What's that?
It's called GPRC5D.
GPRC5D. All right. I'm going to need you to spell that one out for me.
No problem. It's GPRC5D.
Yes.
And this study looked at a GPRC5D targeting CAR-RT therapy in patients who had already tried a lot of other treatments.
So these are folks who really need new options.
Exactly. And the results were really impressive. An 87% overall response rate.
87%. Wow.
Yeah, even in patients who had already received BCMA-targeted therapies.
So this GPRC5D could be a game changer for those who haven't responded to other treatments.
That's the hope, yeah. And the long-term safety data looks promising too.
So effectiveness without a ton of side effects.
That's what we're seeing so far.
That's great.
It's definitely an exciting target to watch.
So we also have another study here on a different GPRC5D targeting CAR T-cell therapy. This one's called anito-cell.
Yeah, this study is really interesting because they followed the patients for a really long time.
Like how long are we talking?
Almost 3 years, a median follow-up of 34 months.
Wow, that's pretty rare in cancer research, isn't it?
It is, yeah. And the results were really encouraging: 100% overall response rate and 79% achieving a complete response or better.
100% response rate. That's incredible.
It is, and importantly, they didn't see any serious neurotoxicities.
So another potential win-win.
It seems that way, yeah.
It sounds like this GPRC5D is opening up a lot of possibilities.
It really is.
Okay, so last but not least, we have one more study to talk about, and this one focuses on how to prevent the cancer from progressing while patients are waiting for their CAR T cells to be manufactured.
Right, because it takes time to make these personalized therapies.
It's not like they can just grab it off the shelf.
Exactly. And so this study looked at using a drug called talquetamab as a bridge to CAR T-cell therapy.
This is like a stopgap measure to keep the cancer in check.
Exactly. And it was really effective. 95% of patients who received talquetamab were able to get their SAW T-cell therapy.
Wow, so it really bridged the gap for them.
It did, and the side effects were manageable too.
This is amazing. We're talking new therapies, new targets, and now new strategies to get patients to those therapies safely.
It's truly remarkable how much progress has been made.
Okay, I need a minute to process all of this.
Me too.
We've covered a lot of ground, but when we come back, we'll step back and look at the bigger picture. What does all this mean for the future of multiple myeloma treatment? Stay tuned.